So this one is like exploratory study, which is a post-hoc analysis based on the BASC IPD, which is individual pooled data set. Just some background about the study. So previously, like large trials such as the INTERACT trial and also attached to trial, they found that blood pressure lowering can reduce the hematoma expansion. And in the previous studies, they also find once the hematoma expansion reduced, the patients would have a better outcome and better recovery. But however, the evidence is quite conflicting. And from the BASC analysis, we found actually those patients who have received the blood pressure lowering, there is no difference on the functional outcomes, like compared to those just received like routine care. So that means actually the effect of the blood pressure lowering on the hematoma expansion to reduce the hematoma expansion, actually it doesn't work on the patient, the functional outcome at 90 days or longer. So in my study, we like to say like what kind of group of patients they have hematoma expansion, but they have a better outcome, and what kind of the characteristics of the group of patients they have received. They reduced hematoma expansion, but they didn't have a functional outcome. So in my study, we used a latent class analysis to identify this kind of groups by the hematoma expansion growth and also the functional outcomes. And from our findings, we find that patients with moderate hematoma growth expansion, they are more likely to be younger, and also they're more likely to receive the surgery procedures compared to those with a mild or a large hematoma expansion. And we also find those across the groups, the baseline hematoma volume is the most important predictors of the hematoma expansion and also the functional outcome. And then we're also looking at if we stratify the patients by the baseline hematoma volume, whether the expansion at the follow-up has association with the functional outcome. And we find that actually in those patients who had a very moderate to large hematoma expansion, actually their expansion growth at the 24 hours is not significant with the functional outcome, which means actually in those patients, probably because they already have a very big and very severe baseline hematoma. So even though they received some management or treatments to reduce the hematoma expansion, but they still cannot get the improve in the functional outcome. So from this study, we also have some kind of future direction to recommend for the future studies, such as we think from this study, there should be more studies on the risk stratifications to select the patients who can actually benefit from the blood pressure lowering and management, and also more studies are needed for the best care for this kind of intracerebral hemorrhage patients.